Okay. Well, we're back in room one, everyone. And lately there's been a lot of people who don't seem to understand what these two things are. This is a fluid warmer. This device is used for people who are hypothermic but don't need rapid administration of fluids or blood products and things. This is the level 1 rapid infuser. This is for people who need both warming of their fluids or their blood products and then rapid administration of it. These two things are made by the same company, and the packages that carry their cartridges look like this. This is for just the fluid warmer. This is for the level 1. Really quickly, to use the fluid warmer, you open up the cartridge. Typically, the patient should be monitored continuously by rectal temperature probe or esophageal temperature probe or something like this so that you don't overshoot. And what you need to do here is to get your cartridge in, and you take it by this little piece here and you just rest it in this groove and push it down into place. When you turn on the device, with its powers over here, you will see fluid will rapidly start to fill through this tubing. Doing it now. One thing to keep in mind is this is the current temperature of the fluid inside the fluid warmer, and that's at 24 centigrade. So that's just a little bit above 76 degrees Fahrenheit. Now, this will warm it to just about 40 degrees centigrade, which is above body temperature. So if you store these devices out in the ambulance bay entrance where it's very cold in the wintertime, this will keep it very cold and it will take very long to heat up. And if you'll notice, even in the time that we've been talking, the temperature already reads 26 degrees centigrade, and I can feel this warming up. So you would prime a liter of saline on a regular IV tubing set, and you would attach it here and just prime it all the way through, and this big sort of wide end gets attached to the patient's IV just in the same fashion. There is no limit on how many liters of fluid or units of blood that you can use through this tubing set here. Now, if you need to use the level 1 rapid infuser, this requires a little bit of work. So open up your set. One thing that I would tell you is figure out, do you really need this? Could you use the fluid warmer with a pressure bag? Or why are we setting this whole thing up after all? Sometimes it's helpful to set this up if you know you have a patient coming in shock. One problem with the patient in shock is that they tend to have very impaired thermoregulation. So the patient might start normothermic, but after we give them liters and liters of fluid and multiple units of blood and everything, their core temperature tends to drop. And so you want to prevent hypothermia if you can. Anyway, this gets put in unprimed. So step 1 is with this part of the tubing up, plop this part into one, and then snap the heat exchanger into this groove, and then pull down on this part here. This should come down pretty firmly on top of the heat exchanger. And then just sort of set these aside. Down below, and someone has taped the cartridge on, but I'm going to take it off just for our purposes of instruction. This is the air trap. This is supposed to prevent air from entering the patient's IV lines, but you can't completely rely on it. It helps, but it's not perfect. This part gets a little bit tricky. So move your pinch clamp kind of out of the way so that you get a nice stretch of tubing from the air trap out. You open up this door, and this I feel like got a little over-engineered, but this door thing opens and closes like this. And the tube, so you snap this part in where it says 4. There we go. And then you put the tubing in like this, and then, it's always a little tricky, this door should be closed. Now, close the little pinch clamps as you go, and you'll see why this is in a moment. So, take a bag of saline or whatever. It's best to start with fluids rather than colloids. And you're going to come up here to these places where we would hang fluids. Now for this purpose, I'm just going to prime it with 1 liter of saline. But you hang it off of this little hook right here inside this plastic case. Again, put your pinch clamps down and your roll clamp here. So, using aseptic technique and wearing gloves and yada yada yada, spike your bag and start to release your pinch clamps so that you can fill your drip chamber. Just get it about halfway full. That's pretty good. Open your roll clamp here and your pinch clamp, and so you can start to see the fluid traveling on its way through. Watch down here that the air trap is filling up. We'll fill all the way up. And then you can let that pinch clamp go. Whew, wow. Fluid's really going now. All right, now I'm going to put this down here, and this is where you would attach it to the patient's IV. You need to have a large bore IV to use this because a lot of pressure gets generated. Nothing smaller than an 18 should be used with the level 1. So if you want to start to use it for its 2 intended functions, turn it on by pushing the green button. We'll go through a bunch of self-check checks here. If ever you see these lighted up, this little icon means check disposables, and so that means that you probably didn't put the cartridge in correctly. So check all your connections. This icon here means that there isn't enough fluid inside the reservoir, and it, by the way, is just sterile water. So anyway, if you want to use it, also note the temperature. So we're starting on at 29 centigrade. It will heat up pretty quickly. If you're going to pressurize the fluids, again, hang the bag on this little plastic door, close the door, that's the latch, and then you can pressurize by using this switch up here. So, watch this. Watch the little pressure indicator go up. It ought to be between 200 and 300 millimeters of mercury. Don't go over 300 millimeters of mercury because you could end up really hurting the patient. It just picked up some air. There, it cleared it. And now we're going along. Look at how fast that fluid administration rate is. Oop, it's fetching more air. There we go. If there is air in here, you can just sort of clank it like this and the air bubbles will dissipate. Just watch the tubing here that you don't see a lot of air. Remember, patients can get some air into their circulation and it won't really hurt them that much, but if there's a lot, that would be a problem. So we're giving quite a bit of fluid, and I can feel this. This feels very warm. That's because it's already at 35 centigrade. We just talked and it was 29 maybe a minute or two ago. Up here, well, we're doing very well. We're staying within our 200 to 300 range. Again, the fluid is just pouring into the patient. What I want to show you is just how fast that liter can go in. You can give blood through this, you can give saline through this, you can give anything else. Whoop. And I think we are almost done. Once you see that the bag is done, if you start to see air come out of it, like it is now, turn off the pressure. You can give at least 4 units of blood through this before the cartridge needs to be changed. That's interchangeable with blood, plasma, platelets, whatever you think needs to be administered very quickly and warmed. Well, that just about does it for the fluid warmer and the rapid infuser. And if you have any questions, just feel free to reach out. But it's fairly straightforward how to use it once you've gone through these steps.